general is excellent to help and improve overall joint range of motion. Understand that foam rolling, typical prescription is anywhere from 30 to 60 seconds. So we don't have to be on this a long time, but we have to make sure that we're doing it appropriately and doing it right. First area we're going to foam roll to improve on overall lower body, let's say preparedness for the activity, is going to be calf, then we'll hit a quad, and then hit a hamstring. In order to do the calf more appropriately with one of these 3-foot foam rollers, set yourself off with a distance so that you have 1, 2, 3 points of contact to lift your body weight. This is a lot easier than attempting to do 2 at once. I'm going to lift myself up and simply roll onto the area. If I find an area of some dysfunction or tightness and or pain, I can provide additional force and just use some gentle range of motion of the foot to help and again just further fatigue the stretch reflex, which will again improve joint range of motion. I can also target some muscles on the lateral aspect of the leg and as well look at muscles on the medial aspect of the leg. Obviously this in a separate position will look just like so. If there are issues with shoulder being able to lift yourself up, you can't keep yourself on the ground and just drag. So there's a lot less weight on the upper body. In hitting up the quad, foam roll is going to be placed above the knee. Keeping the feet down on the ground is one way to start with. And we're moving across. Notice that I'm not allowing the back to slouch or arch into the position. I'm keeping myself in a neutral position to avoid also straightening out my back in this very simple prepared movement. I can place more weight on one leg if I want to address that. Or if I'm having difficulty holding this position, a good starting point would also be to have the foam roller offset. 1, 2, 3 points of contact to make it a bit easier and feasible to get into the leg and also into the inner aspect of the hip. Hamstring position, same is true for the setup. If I want to make it a little easier, place one leg on the ground, other 2 points of contact, and work my way into the hamstring. This other hand can be placed on the foam roller, controlling motion. Remember that your hamstrings originate from the ischial tuberosity or your sit bone, so you do have to go all the way up into that area. You're not on your glutes, you are on your hamstrings. Okay? I could do this with 2 legs, but it does become a bit more difficult, kind of cumbersome and uncomfortable. I would not recommend doing it that way. Again, one leg at a time, using the other arm as well if I wanted to place more load and tension on the hamstring